Welcome to Making the Case. I'm Yodit Tewolde. More than a year after federal health officials first recommended wearing a mask out in public, the CDC announced on Thursday that those fully vaccinated no longer needed to wear covers over their faces indoors or out.
Just a few hours ago, the Center for Disease Control and Prevention and the CDC announced that they are no longer recommending that fully vaccinated people need wear masks. This recommendation holds true whether you are inside or outside. I think it's a great milestone, a great day.
Despite the easing of restrictions, many people are still hesitant to leave home without their masks. Earlier today, Dr. Anthony Fauci appeared on BNC Live to talk about the milestone and how the CDC came to their decision.
It became clear that we were dealing with a vaccine whose effectiveness was even better than what we saw in the clinical trials, so that the protection against infection, the protection against severe disease was so impressive that it was felt that if you were vaccinated, we could start taking those next steps towards normality. And that next step would be to get people to essentially be mask-free with very unusual circumstances where they'd have to wear a mask. And that's the reason why the guidance was changed so that not only do you not need to wear a mask outdoors, but you don't need to wear a mask indoors. So it was really based on science.
There are some exceptions, however, to the new guidelines, and a lot of it depends on what state you live in. Joining me now to walk us through what this new announcement really means long-term is Chief Medical Officer for VeryWell Health, Dr. Jessica Shepard. Hello, Jessica. Thank you so much for coming on tonight.
Absolutely.
All right, so does this mean if a person is fully vaccinated, they can essentially go back to living their life as they were before?
Now, as you say, living their life before, that probably is the hallmark, as you heard President Biden say. This is exactly what we're trying to accomplish by getting back to normalcy in life. So typically what you see with mask recommendations from the CDC is, one, to be protective, but also to get to that point where we have more of a normal lifestyle. So that recommendation from the CDC that changed on Thursday recommended for those who are fully vaccinated 2 weeks outside of their last dose that they do not have to wear a mask inside and outside. However, there are some stipulations, which means that businesses that still do mandate mask wearing, that's where that should be worn as well in healthcare settings.
So is this the right decision to make, given so many have yet to get vaccinated?
This actually is where we should be seeing some of these recommendations move, because again, we have had a year of a pandemic and we have had so many different changes. But now that we have had this hallmark of vaccine distribution, in order to get to a place where we have what we call quote unquote herd immunity, as well as having safety precautions in decreasing transmission, this is exactly what we're trying to do with the recommendations now with a mask for fully vaccinated people. However, if people still do decide that they do want to wear a mask, even if they are fully vaccinated, that again is something that should be taken from an individual stance and should be respected as well.
Okay, so a decrease in transmission, the vaccine distributions, is this what prompted the CDC to release these new guidelines?
Yeah, and as Dr. Fauci said even earlier, that what we're seeing from the vaccination distribution and the outcomes of actual having decrease in transmission is that these numbers are going down, reportedly very low. And if we can keep this type of trajectory with getting more people vaccinated, and even now with the recommendation or the change to have a vaccine for those who are in between the ages of 12 and 15, what we'll most likely see is these numbers are going to decrease even more.
All right, so the CDC, their advice doesn't override mask orders issued by states, right? Counties or cities. New York, for instance, is maintaining its mask mandate. Do you think this can make it more confusing for people?
This is where we see with recommendations that it can be quite confusing because you have differences between states, even counties, and certain cities. Now, we know that New York City was an epicenter when we had the pandemic first reach the United States. But in contrast and comparison, you can see California did a much, not better job, but they did a good job, again, at decreasing their numbers. And you're even seeing that they're lifting some of their mask recommendations as we speak. So again, this is where we need to pay focus and attention to the recommendations, listen to your distinct states and cities and districts in order to find out what is the mask recommendation for where you live or where you're traveling to, and abiding by those rules that are made by those particular areas.
Okay, so I have to ask, what about black people, right? I look at the CDC vaccination tracker and see that twice as many white people as black people are vaccinated. And we know that's not vaccination hesitancy. That's a question of access, right? So did the CDC consider marginalized and vulnerable communities when it made this decision?
Now, there is always that question when we think of health recommendations and also outcomes. So just as you said, there is a shortage, and not rather a shortage, but decrease in access when we think of our black and brown communities of getting access to the vaccine. Now, the other part of that as well is that comorbidities can also play a factor in, if there is transmission of the virus, who is going to have more mortality and succumb to possible bad outcomes with getting the virus. So with the mask recommendation, what we still need to do is, most people, like you said as you were starting, that are hesitant to take their masks off. So, the true recommendation should be what you feel comfort with, but also taking into account where you live, and again, the distribution of vaccine in your particular area. If that is not at a high number, then again, the recommendation would still be to wear your mask. Now, pertaining just to black and brown communities, what we would want to see is making sure that the CDC pays attention to exactly what that statistic is when we look at those communities, and what we can do with budget, whether that's protocol, and also for certain cities and states, making sure that they take those and make sure that those black and brown communities get that vaccine distributed as much as it has in other communities.
Okay, so while we have some time left, are there any myths that you want to bust for those who still have some pause with regards to vaccinating?
Yeah, that's probably the best takeaway of, our discussion tonight is, what are the things that can help reassure people that the vaccine is not bad for them? Is that the word emergency. Now, when the FDA initially came out with the vaccine, it was under emergency mandate, and some people took that as it was emergently made. Now, that is not exactly what it meant. It meant that they took what they already had for the base of vaccines from previous vaccines that they've used, that they were able to use the study and shorten that duration of the study in order to get better outcomes to distribute the vaccine. So again, we're seeing already now, with what we're already at 52% of the country having at least one dose of the vaccine, we are starting to see in great number what those outcomes will be. And they're quite remarkable. And they're proving that, again, the vaccine is very safe. Now, the other thing is, in our community, we need to make sure that we're continuing to have these discussions with healthcare professionals and physicians to make sure that we're answering the question in the way that they may be asked or perceived, and decreasing that hesitancy in our communities to ensure that we're getting the proper information out there and that we're getting the questions answered in order for people to feel engaged and empowered in their decision on vaccines.
All right, Chief Medical Officer for VeryWell Health, Dr. Jessica Shepard. Thank you so very much, sis.
Thank you.